when I'm presenting, there's no problem. And we're happy to treat this as a kind of a discussion. That's fine. Let me see. It's amazing how these windows overlay after you've already practiced doing things. Right, amazing. So thank you for this opportunity. It's great to have a chance to share some of our work with you all. I'm, as has been mentioned, I'm Pritesh Mistry. I'm a policy fellow at the King's Fund. I focus on digital technologies for my work. My background is quite technical, as a physicist and engineer, a number of years in the NHS supporting innovation and research. And now the work that I do is more around kind of how do we get the best out of technology, and how does policy and then some of the national decision making need to change to allow us to get the best out of technology. And so a lot of my work in the past has been quite technical. Now it's quite ranged, actually. I talk a little bit about culture and leadership, as well as the technical kind of details as well. So you're probably all familiar with the King's Fund. It's a health and care think tank. We're celebrating our 125th anniversary this year. And so we do a lot of different bits of work, including research and policy where I sit, but also as an independent organization, we're convening, we're trying to develop leadership and organizational development. And some of the stuff that I enjoy the most is around thought leadership. So how do you, I suppose as Sabine mentioned, how do you ask some of those uncomfortable questions to get people thinking slightly differently, or even ourselves thinking slightly differently? So the work I'm going to talk to you about today was published in March. It's, as mentioned, our work looking at digital exclusion. So we published 4 outputs, as we kind of talk to them as, which are pictured on the right. At the top right is our lived experience piece. That's from talking to people, members of the public, to understand their expectations and their experience of accessing care, both digitally and traditionally. At the top left is our online report. So that's the more pragmatic part of the project, where we provide more information on how health and care organizations, staff and systems can improve inclusion. At the bottom left is our policy brief, and that's more for people with short attention spans. It's only 2 sides. Those national recommendations on what we could do or what should change to make digital more inclusive. And then at the bottom right is a summary, easy read. And so our project was underpinned with a lived advisory group. So they helped us to shape this project throughout the duration of the project, and we worked with them to shape the outputs and some of the key messages, and even what kind of outputs we were thinking of doing. Our research work consisted of a literature review, a survey, trying to understand what's happening in the world, semi-structured interviews with members of the public, workshops with NHS, so with NHS and care providers in the broadest sense, so including NHS as well as charities, voluntary organisations, social care providers, local authorities, so going quite broad with that. So I think before I dive into some of our findings, I'll start with kind of our basis of understanding of what we mean by digital exclusion and inclusion. So by digital exclusion, when we talk about digital exclusion from this point of view, we're talking about the lack of access skills and capabilities needed to engage with digital services, particularly those that help people participate in society. So we're coming at this from a kind of a public service lens in particular. And so digital exclusion being that barrier when digital tools are the preferred way of accessing public services. And obviously public services are public, so they should work for everyone. And as more and more services are going online, the risk is that those who are left behind are unable to access the services. And so the term digital inclusion, in the way that we're thinking about it, is the approach is taken to overcome exclusion. So it's that positive action to overcome digital exclusion. And that includes opportunity, access, knowledge, and skills for using the technology. So we started off, as I mentioned, with a literature review, and wow, is there an extensive amount of literature in this area? I was so glad I had a supportive team of very good people around me to be able to look through this amount of literature. It took us a long time, much longer than we expected. I think the amount of literature speaks to how complex this area is. It feels conceptually it could be seen as being quite easy, but actually when you start digging into the research and the details, it actually soon becomes very quickly complex. A lot of the research tends to focus on particular narrow segments of society or particular parts of the service or geographical regions, so demographics, clinical conditions, and regions, which can result in simplifications, which can be helpful when you're starting to get into this area, but you soon start seeing how there can be guidance, but also restrictive in our thinking. So you'll see literature that shows that elderly populations at most at risk of being digitally excluded, which can be true, but then you can also find literature that shows the absolute opposite. You can find literature that shows that, as you might expect, rural regions are hard, low connectivity. But then there's not really hard and fast rule, because there's literature that shows that urban regions similarly do have connectivity gaps as well. So simplifications can be helpful in the start off, but as you start coming up against the nuances, it can slowly get more and more complex. So the first output that I'm going to talk to you about is the voices of the public. So we spoke to about 2-3 dozen members of the public, just really semi-structured qualitative interviews, trying to understand people's lived experience of digital services, their expectations, their hopes, and their actual experiences, as I mentioned. Quite a range of people from different age groups, different ethnicities, different backgrounds. I think at a high level, I'd say their hopes are not being met. Generally, people are expecting the service to be more digitally enabled. They're expecting, as you probably heard, for the system, as it's talked about as one NHS, to know them. But when their actual experiences are quite fraught with frustration in reality. But when it does work, and in those brief instances when it does work, it's hugely transformative. So these are some of the quotes that are in our lived experience output, and I'll quickly run through people's stories and kind of where they're coming from. So Catherine at the top right is someone who describes herself as a high-functioning deaf individual. She has always felt very excluded from traditional services. She has really high hopes from digital services, but they've not been met. And it's not because of the technology. It's the technology itself is not perhaps easy to use, but she is very digitally enabled. She describes her setup as something out of Star Trek. So she's got multiple monitors, a computer, she's got a couple of phones, and she's very well set up and very confident with her digital tools. But when it comes to using services that are digitally enabled, they don't work for her in the way that they're designed. So she's given a GP appointment, but it's only a phone call, and it's not at a scheduled time. So she doesn't have time to set up her assistive devices when she does have a call. And so these kind of basic things that suddenly become a barrier. That's not necessarily the technology itself. Then, but when it does work, so she has had online consultations with GPs and outpatients consultations that have been online. And when it does work, it's amazingly transformative. So she can use the automated transcription service, and I've seen that, and it feels terrible, but for her, it's amazing. And the staff will correct when the tech gets the medical language wrong, and she's got a written guide of what's being discussed as well as something to take away. So it really can be absolutely amazing for her, but it rarely works. Amy at the bottom right is someone who has previously been homeless, is now housed. She's unable to read or write. Again, she's quite digitally enabled, maybe not on a laptop, but she uses her mobile phone to be able to read stuff out to her, and she can annotate through voice and use the assistive technologies to be able to overcome some of those barriers that she's faced. But not when it comes to the healthcare services. Unfortunately, some of the assistive tools don't work so well, so she ends up having to go to the charity that's been supporting her for her help, which feels quite invasive, and so she doesn't really access healthcare that much because of that. Marie at the bottom is someone who doesn't want to use digital at all. She's not interested, she's not confident, she just doesn't want to do it. So she avoids healthcare services to the extent where she ends up with such a deterioration in her conditions that she ends up in hospital. So when we were doing this project, we were signing off some of these quotes that we're using in our publications. We couldn't get in contact with Marie for quite some time because she'd ended up in hospital because she had deteriorated so badly again. So again, there's something there about choice. BB in the middle is someone who's quite digitally adept, but I wouldn't say she's confident. I think that's what it comes down to. She's concerned that she has to go by the latest technology to get the best consultation because it doesn't often show the images that she sees in real life on her phone. And so she's very concerned about the cost implication. Bill at the bottom left is someone who's had a long-term condition he's had a heart condition for a long time. He's got long-term monitoring, has online consultations with his GP and his consultant, and he thinks they're amazing, absolutely amazing. He is lucky enough that he can afford the devices and the data is in a residential care home setting, so he's not been unable to access digitally, even though the Wi-Fi within the residential home setting is poor. He's been able to have the means to be able to overcome that. And Vasily at the top left is someone who has care responsibilities. Again, it comes down to choice. It's someone that she cares for and her family and supports isn't digitally confident and doesn't have a choice in how she accesses care. And so ends up having to be supported by Vasily. And as it says at the bottom, she ends up taking control of someone else's care, which again, it feels like, and as she kind of talks about, she felt uncomfortable about that. And it's not necessarily how people want to be able to access care. And so some of the barriers that we find aren't necessarily digital in themselves, and it's quite complex, as you can see. Some of the myths that we came across that I think it's important to highlight is that there's a myth that it's a simple barrier, that once everyone is online, so everyone's got a device and data, then exclusion becomes a thing of the past. But as hopefully those stories kind of translate to you, it's a lot more complex than that, and there's multiple factors. There's a myth that digital exclusion is static, whereas in fact it comes down to both changes in personal circumstances and disease. So some of the latest research that's been published shows there's a number of people in this cost of living crisis questioning whether they can afford broadband, mobile data. And so as the cost of living crisis has come in, more people are dropping into being digitally excluded because of their personal circumstances. Also, if you find that your condition means that you can't use your fingers, your dexterity has changed, your eyesight's changed, then again, you might find yourself digitally excluded. So it's not something that once people are digitally included and able to use digital tools, that they will remain there. That might change. Exclusion can be assumed from demographic groups. So, as I mentioned before, it's quite varied, and there are hard and fast rules that help you to do some of the rough bits of work, but as soon as you start getting deeper into it, just soon becomes complex and nuanced. So this is our diagram showing those factors that need to be addressed to support digital inclusion. We talked a little bit about technology, so that includes devices and internet connectivity. Skills and confidence, and that ranges from digital skills through to literacy and health skills as well. The design of technology and the design of services, the support that people have around them, so making sure that people are able to be on a continual journey from novice through to more experienced and more confident people. And lastly, and I think this gets missed often in health, unfortunately, it's privacy. So people who don't necessarily have a space to have a private conversation may feel they're digitally excluded. So we, as part of our advisory group, there was a lady who was at university at the time of the lockdowns and got a mobile phone, quite young, digitally confident, digitally capable, data access, all those things, but not having a private space in that environment. And so she was telling us about how she felt digitally excluded because she didn't have space in which to have a private consultation with her medical professionals. So privacy can be overlooked in this, but is particularly important when it comes to healthcare. Our second output that I'd just like to briefly talk to you about today is our online report. In this, we talk through 3 areas where we think healthcare staff, organizations, providers, and the broader health and care landscape can work together to improve digital inclusion. So, the first area is around fixing the fundamentals, and by fundamentals we mean devices, internet data, and skills and confidence. So we talk through a couple of case studies in this report, and in the case studies, it's amazing how far partnership and collaboration working goes. So everyone's got very little time and resources, but putting it together helps them to go further and be able to reach more people. Being able to provide devices to people that don't have them is a key enabler. And in bringing together NHS organisations as well as charities, voluntary organisations, local authorities, these groups of people are able to either source devices from industry or be able to source donations to be able to buy devices, use those devices from through the charities to give them into communities where people don't have access to devices and don't have devices. And I think it's worth mentioning that one of the charities we talked to supports homeless people, and there was a lot of concerns that the devices would get lost or get damaged, get sold on. But that was not the case. I think it's really important to mention that. And the reason is because these devices are managed in that they are given cybersecurity protection and phishing protection to give people a bit more confidence in how they're using their devices, but they're not limited. They're not locked down. They're not locked down for just NHS use, for example, but they are usable for anything that those users may want to do with them, whether that's social networks or YouTube. Everything that they use their devices for helps to build their confidence, their digital skills, helps to make the device itself more valuable, which means it gets looked after. It's not just, it doesn't become an expensive paperweight. It's something that means a lot to them. And as I mentioned, one of the people we talked to was previously homeless, and that came out in their story as well. So it's very important that they have devices, but they have the freedom to use the devices. Again, providing data is very important. Similar kind of partnership working to get donations. There are access to data banks, which I suppose instead of donating money, they donate data, internet data. A lot of the data tends to be linked to a SIM card, so the users tend to have a lot of fear about that cliff edge of when the data runs out. Then they have to, how do they change SIMs? How do they transfer all that information across? What do they do? And there's still a lot of challenges around that particular transition point. And again, partnership working for building digital skills and confidence is particularly important. So it's not the role necessarily of one organization, but working together to be able to build the skills and confidence of people in the communities, charities, voluntary organizations doing so much in this space to make sure that people who are generally not seen by society have access to digital skills training. There's befriending services so it can build people's confidence. It's not just about using the devices. I mean, some of it's really basic about how you turn a device on, how you charge a device, but then it goes all the way through to what are the digital routes to the NHS. What do you need to look for to make sure you've got confidence in the information that you're looking at? All those kind of things are very important so that people can use public services digitally as well. The second area is structuring services around people's needs and preferences. So this was more around one size not fitting all, having a rigid service with no choice, which means that services are more likely to exclude people. So there's a case study where Roxton Practices has gone through the process of trying to understand how everyone's digital capabilities range, putting that in the electronic services, electronic records, and then communicating to them through those means and suggesting particular services to them. So it's more personalization depending on what they're capable of. And there's also a co-development of services that's happened to create different levels of digitalization. So leaving the traditional services as traditional, adding in digital capability within public areas. So that ranges from NHS areas such as GP practices, on the high street like pharmacists, through to library settings and community settings where there can be volunteers or staff members to support members of the public who are wanting to use those digital services. And then the highest tier is the digital tech at home, where people are confident to use their own tech. And so working with the communities to develop more inclusive services as part of that structure and services, and making sure the choices mean the right thing for people. And thirdly, it's about having consistent services. So a lot of what we heard about was, you go to one GP practice, you get one service, you go to another, you get a different offering, you go to a hospital, you get a different offering. So creating a network of people across a geographical region enables collaboration, enables best practice to be shared. It's not another silo, it's not another organization, it's working within communities to know what works, what doesn't work. It's about creating consistent services so people are more attuned with what they can access and where and how. And very briefly, finally, our policy brief, that kind of what we'd recommend at a national level. Our recommendations are support digital first or digital only services to have physical and low tech alternatives. So that talks about the tiering of the services, not going just digital only, because that excludes people. Incentivizing and supporting suppliers to provide technology that mitigates digital exclusion as much as possible. So allowing for callback features, so people aren't left on their phone running through their data, having online consultation software that uses as little data as possible. So those kind of approaches. Funding and support for tech that narrows gaps in inequalities. So how can technology overcome literacy barriers, some of the traditional barriers we may have seen? So do we still need to support people to have literacy, health literacy, and digital literacy, or can, just as we showed with one of the people we interviewed, having digital literacy can help to overcome some of those traditional barriers? We also suggest working across government to tackle systemic barriers. So connectivity, for example, technically, it's a solved problem. In reality, it's not. So how do we, one of our recommendations is working cross government to actually say, how do we make progress in this in a way that is meaningful for the public? And then, as I mentioned, kind of supporting and enabling ICSs to have that capability and resources, create the hubs to be able to do co-development and work within communities to create more inclusive services. So I think I've slightly gone over, so I'm going to stop there. That's a summary of things I've basically already talked through. So let me stop sharing, and I think there's a couple of questions that have come through, but if anyone wants to kind of just jump in with discussions and questions, I have to